Hello everyone, this is Shalu Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. I'm back with another video for your adult NMC OSCE exam. So if you like my videos, please press the like button now and subscribe to my channel. It just gives me a lot of positivity to keep making more videos for you, and hopefully these videos are helping you in preparing for your upcoming OSCE exam. Okay. So let's talk about today's video then. In today's video, I am going to give you my top 10 tips which are also the common fails for your assessment station. Okay, so as you know, assessment is the biggest station in your exam with the real actor. So I think hopefully this will really help you not to make those mistakes because assessment is again a station which has high fail rate in exam as well. So we're going to go through and look at the top tips so you don't end up making those mistakes, and use those top tips to stay safe and pass that station. So that's what today's video is going to be about. So it's about the assessment station top tips. So let's get started. Okay, the first one, I can't tell you how important it is that you can identify your patient correctly. Lots of people fail on this simple thing. How do you correctly identify your patient in hospital scenario, and if you are in community and you've been given a community scenario, how do you identify your patient correctly? So let's look at the correct technique. So if you're in hospital, your patient will be wearing a name band and and if they're allergic to something, then they'll be wearing a red allergy band. So it's really important that you apply the right technique. So the correct technique is it's a three-way check in hospital. So what your patient says should match what's written on their name band, and also should match what is in your given documentation, which is your patient history form. So it should match all those three things. So you will ask your patient for their full name, look at their name band that is written correctly, and then matches that against your correct page of the documentation. Go and look for those details in your documentation. So the name, and then you be checking the date of birth in the same way. Your patient doesn't know their hospital number, which is the medical record number, which is MRN number in UK. So you will just look at their name band. It will be written on their name band, and then you will check that against your documentation. Okay, so the name and date of birth, you're going to ask the patient, look at their name band that is written correctly, and check that against your documentation. MRN number, just check from the name band against your documentation. Okay, so that is if your patient is in hospital scenario. What if it's in community? In community scenarios, your patient will not be wearing a name band and allergy band, so you just need to verbally check, and they don't have a hospital number. So verbally check their name, date of birth, and address against your documentation. Okay, what they say should match your documentation. Again, no ID check is complete without allergy status, so make sure you check the allergy status, and remember to check it at the same time when you're doing the ID check. So it means later on you're not going to forget that. So just make sure that you are doing that. Okay, so you will go ahead and the same way ask the patient allergies and check that is correctly written in your documentation. Okay, so that's really important. And also check the reaction of the allergy. Okay, so if you're asking about allergy, always ask about reaction as well, and check that in your documentation. So that's the first top tip, correct ID and allergy status check. Second top tip is gaining consent. Now really important. You may think it's a simple point, but it isn't. So you make sure you explain clearly what you are here to do and take a valid consent. So you tell your patient that you're going to be checking their vitals, carrying out A to E assessment, and also talking about their nursing needs in this assessment station. So explain it clearly and take a informed consent. Informed consent means telling your patient clearly what you're here to do and giving them time to think and say yes. Okay, so don't proceed until your actor says yes. Okay, so that's the tip number 2. Tip number 3 is that you use correct technique for taking your vitals, okay, because assessment station, as you know, is big part of the assessment station is taking patient vitals. So you're doing full set of vitals, so make sure you apply the cuff correctly for blood pressure, you make sure you do your capillary refill correctly before you apply the saturation probe. It means you are pressing the finger for 5 seconds, so you're counting in real time, letting it go and seeing if the color comes back within 2 seconds. Okay, so you have to show your examiner the correct technique because lots of people are failing on that. And again, when you're doing your heart rate and your respiratory rate, make sure you are counting for 1 full minute each. Okay, 1 minute for heart rate, 1 minute for respiratory rate in real time. And when you're doing the respiratory rate counting, you are looking at the patient chest for other respiratory pattern as well. Okay, so you're looking for chest movement, you're looking, then using any accessory muscles and all that. Okay, so in that 1 minute you can look for all those things which you have to then verbalize later on into your A2E assessment. So making sure that you do not cut any corners. Is a full minute for heart rate, full minute for manual heart rate, and full minute for respiration. So that's your correct technique. And of course you're going to check the temperature of the patient by scanning their forehead. Okay, so that's what they're using in exam. They're using the forehead thermometer, so it's just the infrared thermometer. Okay, so that's what they're using. So if you don't know how to use their equipment in exam, just ask the examiner to show you before you start the station. Okay, before your timer has started. Right, so that was tip number 2, correct technique for taking vitals. Tip number 3. So now we're going to move on to tip number 4, which is conducting that complete A2E assessment of your patient. Now, you have been given a marking criteria by the test center, which I'm showing you on the screen now. So of course you're going to go through your airway, breathing, circulation, disability and exposure, but you need to do it systematically and you need to do in full. Okay, so what I mean is airway is very simple. If your patient is talking to you, you can watch my other video which I have already done on A2E assessment to revise this part of the station. So you are making sure that you're doing according to your marking criteria. Like I said, airway is very simple. If your patient is talking to you, you know there is no obstruction. And then moving on to breathing. Breathing is just not saying what is your patient respiratory rate and saturation, is commenting on everything else with the depth, the rhythm of breathing, any other signs of respiratory distress, any cough, any wheeze. So you be asking your patient that, and you be commenting on whether when you did the assessment of the respiratory pattern, was the chest moving equally on both sides, there was no use of accessory muscle, there is no seesaw breathing. So it's a complete assessment. That's what I'm trying to say. So look at your marking criteria. In circulation, again, it's not just only the heart rate, but it's the rhythm, the strength of the heart rate as well, and your blood pressure and capillary refill, and also the perfusion of your patient. So you should be looking at their skin, checking, obviously, you check the capillary refill already, but looking at the skin color and commenting on that is well perfused and there is no pallor. Okay, disability, I just quickly tell you, is all about, again, patient's conscious level, alertness level, pain, blood glucose, and urine output. Okay, so like I said, I have already covered this in the full video, so you can go and watch the video on A2E assessment. And again, in exposure, we look for any signs of infection. That's why we're talking about temperature. And don't forget to review your patient medical history, which is already given to you in your patient recent history form. Okay, so look at that in your documentation, is already given. So that's really important. So what I'm trying to say is a complete A2E assessment, no shortcuts. Number 5 is charting. Okay, so this is very common reason for fail in assessment station. I would say if somebody is going to fail the assessment station, 70% of the time it is on charting. So make sure you know how to chart correctly on your news chart or your GCS chart, depending on your scenario. So if you have a hospital patient, medical, surgical, or a community patient, you will be getting news chart to complete. And if you have a neuro patient, you will be getting GCS chart to complete. So you make sure you know how to complete it. You make sure you verbalize correct monitoring frequency of their vitals once you completed it, and the escalation. So that has to be correct, and also don't forget to add the date, time, patient details, and all that. So there is no mistakes allowed in charting. So you need to make sure you can complete these charts really well, and also you know your news monitoring frequency and escalation really well as well. Okay, because you have to clearly verbalize that. Tip number 6. Now we're coming up to the nursing assessment of your patient nursing need. Your marking criteria says conduct a holistic assessment relevant to patient scenario. So it's patient needs. So you will focus on patient main needs. So you've been given the scenario. You have already read that in the beginning of the station. So this is patient, you call a patient overview history form. So you already looked at it. So you should focus on their main nursing needs. As you can see on your screen now, by the way, this scenario is just for teaching purpose. It does not belong to a real patient. So just for teaching purpose. So you can see here the patient come in with shortness of breath due to pneumonia. They have loss of appetite. Their mobility is poor. They are worried about their wife at home. They're also a smoker. So these are my main points I should be covering in my nursing need assessment. So I am focusing on that. Okay, so my scenario is giving me hint. So always look at your presenting complaints given in the patient overview of history, recent history form, and relate to your scenario when you're doing nursing need assessment. Okay, so that's really important. So next we're going to look at number 7. So it's not just only the physical problems you're looking with the patient, but you're also looking in other aspects of their health and well-being. Okay, so don't forget, we say comprehensive assessment, so don't forget to talk about all 4 parts of the holistic assessment. It means you're looking at the physical needs. Now physical needs are mainly your activities of daily living, so you can choose 2 or 3 physical needs depending on your patient scenario. So like you could be talking about breathing, you could be talking about mobility, sleep, eating, drinking. Again, it would be different nursing needs depending on your patient presenting symptom and diagnosis. But you can focus on only mainly 2 or 3 needs. Okay, then you need to move on to their psychological status as well. It is your emotional need, any family needs, anybody at family they're worried about, anybody you can ring at home for them to let them know how they're doing in hospital. So things like that. And then spiritual part of it is your patient has any spiritual need specifically or any religious needs. So you got to be looking at that. In sexual needs is just making sure your patient preferences. So it's like, would they like a male or a female carer if they are going to need some personal hygiene or walking to the shower or the toilet or whatever. So you know that you could talk about that if they have any particular preference, whether they like to be looked after by male or female carer when it comes to their personal hygiene. Okay, not for everything, but just personal hygiene. So you should be looking at things like that. So what I'm trying to say is a holistic assessment. It's not just the physical need and activities of daily living, it's everything else as well, which they are telling you in the marking criteria to do a holistic assessment. Okay, so number 8 is hand hygiene. Now don't underestimate it. It has to be done correctly using 7 steps as per World Health Organization, and also 5 moments. So remember to do it at the correct time, correct places in your station. So that's really important that you are doing that correctly and that you are using all your 7 steps every single time you do the hand hygiene. Okay, so that's really important. It's no benefit of doing first hand hygiene really good and then other hand hygiene you're missing steps. Your examiner will be looking at that. Okay, so the top tip will be, make sure whenever you're cleaning your hands at home or at work, make sure you always apply 7 steps. Then it just will become a habit for you. Okay, you don't have to think about it in your exam. So that's another one. Number 9 is listen to your patient, show compassion. This station is always with a real actor in your exam, okay? So with a real person. So making sure that you treat that as a real patient and you're building a rapport with your patient, you're listening actively if they're raising a concern, you are answering their questions as much as you can do given the time restraints, but you are actively listening to your patient, okay? So if they're asking you something, make every effort to answer that straight away, okay? Don't leave it to the end. So show compassion, listen actively, build a rapport, and your speech has to be very, very clear. Your communication, your examiner is looking at it all the time, so it has to be clear. Your speech has to be very clear with your patient. Number 10 is, obviously, you know this one, keep an eye on the timer. You know it's a 20-minute station. You have a lot to do in 20 minutes. You got to do vitals, you got to plot, you got to do A to E assessment, you got to talk about the nursing need and holistic assessment. So it's a lot to do. So how do you prioritize? Making sure, first thing is there's no extra reading time. You know, I told you there is a patient recent history form which has information about your patient, recent history. So you will read that as part of the 20 minutes. There is no extra time. So, okay, don't go in the exam thinking I'm going to get 5 minutes to read this. No, that would be counted as part of your 20 minutes and you will read that in the beginning. As soon as your 20 minutes start, read that and then go into your scene safety, privacy and all that, okay? So that's really important, that you don't have a misconception that you're gonna get extra time. You will not. It's part of 20 minutes. Next one is prioritize, taking your vitals, plotting them correctly, completing your A to E assessment. Talk about the nursing needs right towards the last part of the station, because you really need to prioritize your documentation and taking vitals correctly and doing correct A to E assessment. That's really, really, really important. And then whatever time you got left after that, then talk about their nursing needs, making sure you talk about the physical aspects of a psychological, spiritual and sexual aspect of their nursing needs, making a holistic assessment. So that's what you need to do in 20 minutes. A lot to do. Hopefully these 10 top tips are going to keep you on track and you will not make these mistakes, because they're all reasons for common fails. And I told you the biggest fail in this station is always about charting. Okay, so make sure you know your news chart, you know your GCS chart. So I hope you like this video, and hopefully it will help you to show your examiner that you're a safe practitioner and you can assess your patient safely in exam. Okay, so if you like this video, please press the like button now and subscribe to my channel. You can also visit us on OSKInurstraining.com and also email us about our training on OSKInurstraining@outlook.com. I will soon be back with another video for you. Bye for now.